I rise today to recognize February as National Children's Dental Health Month. Since 1981, this month has afforded us the opportunity to acknowledge the importance of children's dental health, recognize the significant strides we have made and the work that remains to be done, and renew our commitment to ensuring all children in our country have access to affordable and comprehensive dental services. To echo former U.S. Surgeon General C. Everett Koop, there is no health without oral health. Despite being largely preventable, tooth decay is the single most common chronic health condition among children and adolescents in the United States. It's 5 times more common than asthma and 20 times more common than diabetes. Nearly half, 44%, of the children in the United States will have at least one cavity by the time they start kindergarten. Children with cavities in their primary or baby teeth are 3 times more likely to develop cavities in their permanent adult teeth, and the early loss of baby teeth can make it harder for permanent teeth to grow improperly. Left untreated, tooth decay can not only destroy a child's teeth, but also can be debilitating impact on his or her health and quality of life. Tooth and gum pain can impede a child's healthy development, including the ability to learn, play, and eat nutritious foods. Recent studies have shown that children with poor oral health are nearly 3 times more likely to miss school due to dental pain, and children reporting recent tooth decays are 4 times more likely to have a lower grade point average than their peers without dental pain. Tooth decay and oral health problems also disproportionately affect children from low-income families and minority communities. According to the National Institutes of Health, approximately 80% of childhood dental disease is concentrated in 25% of the population. These children and families often face inordinately high barriers to receiving essential oral health care, and simply put, the consequences can be devastating. Madam President, many have heard me speak before about the tragic loss of DeMonte Driver, a 12-year-old Prince George's County resident. In 2007, DeMonte's death was particularly heartbreaking because it was entirely preventable. What started out as a toothache turned into a severe brain infection that could have been prevented by an $80 extraction. After multiple surgeries and a lengthy hospital stay, sadly, DeMonte passed away. 9 years ago today, we marked the 9th anniversary of his tragic death. Since the tragic death of DeMonte in 2007, we have made significant progress in improving access to pediatric dental care in the country. For example, in 2009, Congress reauthorized the Children's Health Insurance Program, CHIP, with an important addition: a guaranteed pediatric dental benefit. Today, CHIP provides affordable, comprehensive health coverage, including dental coverage, to more than 8 million children. Thanks to CHIP, we now have the highest number in the history of children with medical and dental coverage. In addition, in 2010, Congress included pediatric dental services in a set of essential health benefits established under the Affordable Care Act. I'm very proud that my state of Maryland has been recognized as a national leader in pediatric dental health coverage. In 2011, Pew Center report, The State of Children's Dental Health, Maryland earned an A and was the only state to meet 7 of the 8 policy benchmarks for addressing children's dental health needs. In addition, in the Maryland Health Benefit Exchange, every qualified health plan now includes pediatric dental coverage, so families do not have to pay a separate premium for dental coverage for their children and do not have a separate deductible or out-of-pocket limit for pediatric dental services. However, Madam President, more work remains to be done. For example, according to the recent report by the Department of Health and Human Services, Office of Inspector General, 3 out of 4 children covered by Medicaid did not receive all required dental services over a recent 2-year period, with 1 in every 4 failing to see a dentist at all. This is simply unacceptable, and we must act to ensure that all American children have access to comprehensive oral health care. I urge my colleagues to join me in this effort. Tragically, our healthcare system was not there for DeMonte. Today, on the 9th anniversary of his death, let us honor his memory and pledge to do better for the children in our country. By working together to build on the significant strides we have made over the past 9 years and to ensure all children have access to affordable and comprehensive pediatric dental services.